eggs are used in a small grouping of patients that we see. Certainly, I discuss it with any of my patients who are over 40 as an option. For some patients, it just doesn't resonate with them. They're just not interested and they'd rather pursue adoption, and that's fine. We're happy to support that. But for others, they really value the idea of carrying a pregnancy themselves, and the origin of the egg is less important. For those patients, donor egg is a great option for conception. Many private practices have ongoing relationship with egg donors within their communities, and either can provide fresh eggs or actually frozen eggs. And for some patients, if they have very specific requests, be they ethnicity or educational background for their egg donor, we actually can use nationwide egg donor databases to identify the preferred egg type for a patient to conceive with. We see all different kinds of patients at my practice. For some women, they prefer utilizing donor sperm because they're not currently partnered, and so they choose to build a family on their own as a single mother by choice. Using donor sperm is relatively straightforward. It can be purchased through numerous different sperm donor banks, and we help the patient to select an appropriate sperm donor that's free of any kind of infectious disease or genetic conditions. For other patients of mine, they may be in a same-sex relationship or partnered with someone who's transgendered who also require utilization of donor sperm for conception. Finally, for some of our patients, they unfortunately have very low or absent sperm counts due to previous treatment, so cancer survivors, for example. Those patients who haven't banked sperm previously would be offered donor sperm during a consultation. Finally, some patients who are partnered but unfortunately have had to undergo treatment for cancer with chemotherapy or radiation, this can be harmful to sperm counts. And so if sperm counts are low or are absent, those patients would be offered donor sperm during an initial consultation. When using donor sperm, I give all patients guidance about finding a good fit for them. Now, some people have very specific preferences about height or educational background or appearance. What I care about is that someone selects a sperm donor who doesn't have a similar genetic predisposition to their own. And so I encourage people to think about their Thanksgiving dinner table. Maybe there's a strong family history of diabetes or a strong family history of hypertension. So I encourage them to pick sperm donors who don't share that same family predisposition so that the resultant child doesn't have a compound risk factor from each biologic parent. We work with several different sperm banks and help patients to select donor sperm that's likely to result in a pregnancy.